Before receiving the vaccine, it's important to read all the vaccine information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. The Arexvy Antigen Component 120 mcg suspension respiratory syncytial virus (RSV) vaccine is administered by injection into a muscle in the upper arm by a healthcare professional. This vaccine is used to help prevent respiratory syncytial virus (RSV) in children. It is recommended to follow the dosage schedule recommended by your healthcare professional for optimal protection. The best time to take this vaccine is in accordance with the schedule provided by your healthcare professional. After receiving the Arexvy vaccine, you may experience soreness, redness, swelling, or bruising at the injection site. You might also have muscle aches, joint pain, headache, or tiredness. These symptoms are usually mild and temporary. In rare cases, some people may experience fainting, dizziness, vision changes, or ringing in the ears shortly after getting the injection. If any of these symptoms persist or worsen, it's important to contact your healthcare professional. It's important to remember that your healthcare professional has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people who use this vaccine do not experience serious side effects. Although it is rare, a very serious allergic reaction to this vaccine may occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your healthcare professional for advice. If you experience any side effects, you can report them to the Vaccine Adverse Event Reporting System in the U.S. at 1-800-822-7967, or to the Vaccine Safety Section at Public Health Agency of Canada in Canada at 1-866-844-0018. Before receiving the Arexvy Antigen Component 120 mcg suspension respiratory syncytial virus (RSV) vaccine, it's important to let your healthcare professional know if you have any allergies, especially to vaccines, or if you have any other allergies. This vaccine may contain inactive ingredients that could cause allergic reactions, so it's crucial to discuss this with your healthcare professional. Make sure to also inform your healthcare professional about your medical history, particularly if you currently have a fever or illness, or if you have any immune system disorders such as HIV infection, certain cancers like leukemia or lymphoma, or if you've had radiation or cancer treatment. If you are pregnant, your healthcare professional may recommend the RSV vaccination. It's important to have a discussion about the potential risks and benefits with your healthcare professional. It's also important to note that it's currently unknown if this vaccine passes into breast milk. If you are breastfeeding, consult your healthcare professional before receiving this vaccine. When taking Arexvy Antigen Component 120 mcg suspension respiratory syncytial virus (RSV) vaccine, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This vaccine may interact with other medications, so it's crucial to keep a list of all the products you use and share it with your healthcare professional. It's important to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. Make sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. Arexvy Antigen Component 120 mcg suspension respiratory syncytial virus (RSV) vaccine is used to prevent a certain respiratory virus (RSV) in children. This vaccine is given to infants and young children at high risk for RSV. It helps to reduce the risk of severe lung and respiratory infections caused by the virus. The vaccine is usually given in a series of doses and is administered by a healthcare professional. It is important to follow the recommended schedule for the vaccine to ensure maximum effectiveness. Make sure to consult with your child's healthcare provider for the appropriate dosage and timing for the vaccine. Make sure to attend all scheduled medical and laboratory appointments. This will help ensure that you receive the proper care and monitoring while using Arexvy Antigen Component 120 mcg suspension respiratory syncytial virus (RSV) vaccine. Arexvy Antigen Component 120 mcg suspension respiratory syncytial virus (RSV) vaccine is used to prevent a certain respiratory virus (RSV) in children. This vaccine is given to infants and young children at high risk for RSV. It helps to reduce the risk of severe lung and respiratory infections caused by the virus. The vaccine is usually given in a series of doses and is administered by a healthcare professional. It is important to follow the recommended schedule for the vaccine to ensure maximum effectiveness. Make sure to consult with your child's healthcare provider for the appropriate dosage and timing for the vaccine. Make sure to store this vaccine in the refrigerator, but be careful not to freeze it or expose it to light. And as with all medications, keep it out of reach of children and pets. When it comes to getting rid of any leftover or expired vaccine, don't flush it down the toilet or pour it down the drain. Instead, consult with your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.